I worked the registration desk at a hospital in Amsterdam. An American woman walked in holding her ankle, clearly in pain. She limped to my counter and said, "I need to see a doctor right now." I have insurance. Told her to take a seat and fill out the intake form. She looked at me like I'd asked her to perform surgery on herself. These reactions aren't outliers, they're patterns. I've spent years collecting these cross-cultural collisions, documenting what happens when American assumptions meet global systems. If seeing the world through that lens interests you, you'll want to stay close to this channel. Fill out a form? I'm literally injured. In America, they take you straight back. I explained that even emergency cases need registration. She wasn't having it. This is ridiculous. I could be dying. Her ankle was slightly swollen. She demanded to know how much the visit would cost. I said around 80 euros without insurance involvement. She gasped. 80 euros. That's like $100. For what? A Band-Aid? I told her that included the doctor consultation, X-ray, if needed, and any basic treatment. She stared at me. That's impossible. X-ray costs $3,000. When the doctor saw her 20 minutes later, she asked him if he was a real doctor because the visit was too cheap to be legitimate. Been practicing for 15 years. My friend in Berlin had an American tourist refuse a prescription because the pharmacy looked too small to be real. A hotel concierge in Tokyo once translated for a guest who insisted Japanese. Hospitals were practicing experimental medicine because they used different equipment than America. These stories share a common thread: the absolute certainty that healthcare only works one way. A man came into our Stockholm clinic with a bad cough. After examining him, our doctor prescribed antibiotics and told him to pick them up at the pharmacy downstairs. The man asked what his copay was. Our doctor said there was no copay, just pay at the pharmacy. He looked suspicious. What's the catch? No catch? Sweden subsidizes prescriptions. He went downstairs, came back 5 minutes later and said the pharmacy tried to scam him. They'd charged him 40 kronor, about $4. He thought they'd made a mistake and charged him for dollars instead of 400. When I explained that was the actual price, he demanded to see the unsubsidized price. I showed him. The medication cost the government about 300 kronor, but patients pay a maximum of 40 on the subsidy program. He studied the receipt like it was a counterfeit bill. Then he asked if the medication was expired or generic knockoff, because real antibiotics cost at least $200 in America. I told him it was the exact same manufacturer as the American version, just priced differently. He didn't believe me. He went to 3 other pharmacies to compare prices. They were all the same. He finally accepted it, but told me he was keeping the receipts in case the medication doesn't work. He seemed genuinely angry that healthcare could cost less. That disbelief is what fascinates me, the idea that affordability feels like fraud. I unpack that kind of cultural wiring every week. If you value decoding how societies think, not just what they do, this is the space built for that. I worked at a Paris emergency clinic near the Louvre. An American came in after twisting his knee on cobblestones. We treated him, wrapped his knee, gave him pain medication, and sent him home. Total time, 90 minutes. Total cost, 65 euros. He refused to pay. Not because he couldn't afford it, because he insisted we hadn't charged him enough. "You're trying to hide fees," he said. "I want the real bill." I showed him the itemized bill. Everything was listed. He shook his head. "No, the real bill. The one with the hospital facility fee, the doctor fee, the nurse fee, the equipment fee, the administrative fee." I told him France doesn't work that way. We have one bill. He thought we were incompetent. "You forgot to charge me for the wrap," he said, pointing to his knee bandage. I told him it was included. He pulled out his phone and started Googling France hospital hidden fees scam. He found nothing. He paid, but looked disturbed, like he'd participated in something illegal. As he left, he asked if the French government would send him the rest of the bill later. When I said no, he muttered, "This doesn't make sense." A woman arrived at our Norwegian dental clinic for an emergency tooth extraction. Simple procedure. The dentist numbed her, pulled the tooth, gave her aftercare instructions. She asked for the bill. I told her 200 kroner. About $20. She laughed. Then she realized I wasn't joking. Her face went pale. Are you serious? I nodded. She asked if Norwegian dentists were actually qualified because real dentists cost thousands. Our dentist studied at Oslo University and had 20 years of experience. She didn't care. She wanted to know what we'd cut corners on to make it so cheap. I explained, Norway's healthcare system covers most costs. She asked if the equipment was sterilized. Yes. She asked if the anesthetic was real or watered down. Real? She asked if we'd actually pulled the whole tooth, or just part of it. I showed her the extracted tooth in a medical tray. She examined it, then asked if we were going to charge her later when the government processed the claim. I told her there was no claim, this was the price. She paid but stopped at the door. I'm reporting this to the American embassy. Something's illegal here. I manage a health center in Munich. An American man arrived, demanding to know which doctors were in network. I asked what he meant. He said, in network, covered by my insurance. I explained that in Germany, if you're insured, you're covered at any doctor. There's no network. He didn't understand. That's impossible. Every insurance has a network. I told him German health insurance works differently. He insisted I was wrong. I have Aetna. They have a network. I explained Aetna doesn't operate the same way in Germany. He pulled out his insurance card and pointed at it. It says right here, nationwide coverage. Told him that meant America, not Germany. He looked at me like I was stupid. Nationwide means the whole nation. I said yes, the American nation.
Ow.
He demanded to speak to someone who understands insurance. I got my supervisor. My supervisor explained the exact same thing. The man accused us of trying to avoid filing claims. He wanted our provider ID number to submit to Aetna himself. We don't have one. German clinics don't submit claims to American insurance companies. He threatened to sue us for discrimination. You have to accept my insurance. It's illegal not to. We told him to contact Aetna about international coverage. He called them right there in our waiting room. They told him he'd need to pay up front and request reimbursement. He hung up and glared at us. This is your fault. A British hospital hired me to help with American patients. One woman came in for a minor procedure and kept asking about her deductible. I told her the NHS doesn't have deductibles. She said everyone has a deductible. I explained the NHS is free at the point of service. She insisted that was impossible. Someone has to pay. I said taxpayers fund it. She shook her head. No, I mean who pays right now? I told her nobody pays right now. That's the point. She stared at me. Then how do you know I'm not lying about being sick? I said doctors determine that. She wasn't satisfied. In America, the insurance company checks if you're really sick. I told her doctors do that here, not insurance companies. She asked how we prevent fraud. I said the same way America does, doctors use medical judgment. She looked doubtful. This seems like a broken system. After her procedure, which cost her nothing, she asked for an itemized bill for her records. I explained the NHS doesn't give bills to patients. She demanded one anyway. I need proof this happened. I offered her discharge paperwork. She said that wasn't the same. I need to know what this would have cost. I told her we don't calculate that. She left confused and vaguely angry. An American student came to our clinic in Copenhagen with the flu. We prescribed Tamiflu. He asked if we accepted his college health insurance. Well, I said we don't process American college insurance. He'd need to pay and seek reimbursement. He asked how much. I said about 100 kroner for the consultation, another 100 for the medication. He did the math. About $30 total. He squinted at me. Is this a free clinic? No, regular clinic. He asked if we were sure we'd charged him correctly. Yes, he said. In America, Tamiflu alone costs $300. I told him medications are priced differently in Denmark. He seemed personally offended. Why is America so expensive then? I didn't have a good answer. He paid but looked betrayed, like America had lied to him his whole life. Then he asked if Danish Tamiflu was the same strength as American Tamiflu. I showed him the package. Same manufacturer, same dosage. He took a photo of it to prove to people back home. As he left, he said, "I'm moving here." I work at a medical clinic in Melbourne. An American family came in because their daughter had an ear infection. Straightforward case. The doctor examined her prescribed antibiotics and sent them to the pharmacy. The father asked for the bill. I told him $70 for the visit. He nodded, then asked when the real bill would arrive. I said that was the real bill, he explained slowly, like I was confused. No, the big bill, the one with all the codes and the insurance adjustments and the out-of-pocket maximum. I told him Australia doesn't send those. This was the bill. He pulled out a folder on, actual physical folder filled with documents. I have our insurance cards, our HMO approval, our referral from our primary care physician, our prior authorization forms. I told him he didn't need any of that. Just pay the $70. His wife interrupted. Is this socialized medicine? Kind of, yes. She looked horrified. We don't believe in socialized medicine. I wasn't sure what to say to that. Their daughter's ear was still infected regardless of their political beliefs. The father asked if they could pay the American way. I asked what that meant. Said, where we pay a little now, and the insurance pays the rest later, and then we get surprise bills for 6 months. I told him that's not how Australia works. He seemed deeply uncomfortable with this, like we were forcing him into a system he hadn't consented to. Finally, he paid the $70, but made me write paid in full on the receipt. He didn't trust that more bills wouldn't appear. As they left, their daughter asked, "Why was that so easy?" Her father said, "It shouldn't be. Healthcare looks different everywhere. Americans grow up thinking medical care costs tens of thousands because that's their reality. When they encounter systems where a broken bone costs €50 or antibiotics costs $5, it breaks their understanding of how the world works." If you recognize that kind of mental short circuit the moment someone's worldview collapses under reality, you'll find this channel addictive. We track those collisions across cultures, industries, and ideologies. Subscribing just means you won't miss the next one. They're not stupid, they're genuinely confused because they've been taught healthcare is expensive, complicated, and tied to employment and insurance networks. Next time, we'll explore what happens when Americans try to understand foreign education systems. Spoiler, they have opinions about school uniforms, university costs, why everyone doesn't just work hard and get scholarships.